Sciatica pain down the back of your leg is one of the most painful things, and I'm going to show you in this video how to get some relief. My name's Wynd, I'm a physiotherapist, and if you're wondering what on earth I'm doing down here on the floor, it's one of the few positions that you can get relief. And I give this out to patients each week here in the clinic for low back, in particular sciatica pain relief. It's called the astronaut position. In this video, I'm going to show you our 3 exercises that will give you some relief for sciatica if you're suffering from that painful condition. Make sure you watch right through to the end because I've got some bonus tips as well that will apply as we dive a little bit deeper. Before we get into the 3 exercises, you need to know what sciatica is. The sciatic nerve comes off your lumbar spine, your low back. It runs out through a little notch deep in your glute, in your butt area, down through the back of your leg, your hamstrings, all the way down your calf to your foot. And anywhere along that line, something can squash or restrict that nerve and cause that sciatic nerve to get grumpy, and we call that sciatica. The most common cause of compression on that nerve is up in the low back, and I'll show you some of the tips at the end. But here's the first exercise to get some relief. In this position, we call it the astronaut position. It really decompresses and takes away gravity. So you'll find this is one of the most relieving positions, and some patients even sleep in this position because they're in that much discomfort. The first exercise we're going to do is called a nerve floss. And what you're going to do is grab your leg that you're feeling the symptoms down. Now what this does is, rather than stretch the nerve, which can often irritate the nerve, it gently gets that nerve gliding again and removes any restrictions along the pathway of that nerve. You might find that you can't straighten the knee very far, and that's totally okay, that's normal. Do not push this one, only just take it to where you feel a stretch down the back. If you're going well with that after, let's say, normally 8 to 10 repetitions is actually plenty, you can then start to move the toes up and down like I'm doing here. So another 10 of those at just the ankle and the toes. We call that one nerve flossing. That'll be ideally done every few hours, twice a day minimum, to be really effective. Okay, exercise number 2 that will relieve it. Remember I said the nerve passes through the butt area as well, so we're going to do a gentle stretch of that. Turning the hip out and knee out like so. We grab the other leg and gently pull back until you feel a stretch through here. So this is a gluteal stretch. That is where the sciatic nerve heads out before it goes down the leg, and that can often relieve things as well. Hold this one for at least 30 seconds. Again, be gentle. Build up to 60 seconds. I like repeating this twice, and that's the advice I give most of the patients as well. And again, this can be done minimum twice a day, more if you find it's really relieving. So that's exercise number 2. Exercise number 3 relates back to actually your low back, like what we were talking about before. So lying on your back, in fact, I might demonstrate this up on the table here, so you can easily see. So lying up on a table, you can do this on the floor as well. Like so, nice and supported, gently rotating side to side. We call these lumbar rotations. And this helps free up the low back, which is often where the compression on the sciatic nerve is starting, and just gently side to side. What you'll probably find is that one way is a little bit restricted and the other one is much more free. Be gentle. Only push into that restriction if it feels comfortable to do so, and this will help relieve the low back component to your sciatica. I like, again, simple numbers. 10 each side is a good place to start. Twice a day if it's feeling good. Can do it more times if it's working for you. So those 3 exercises will really make a big difference in relieving the sciatica. And I mentioned a bonus tip, so I'm going to go through that now. Remember we said earlier that most of the sciatic compression, the source of the sciatic compression is often up at the lumbar spine, and it's commonly a lumbar spine disc. If that is the case, and if you're unsure, make sure you seek some professional advice. Then this exercise is really going to make a difference. We'll come back down to the floor again. And for this one, we call these lumbar extensions. Initially just propping up like so. You're going to push up until you feel a little pinch in the back, and gently back down again. And again coming up. 10 of these, and again, don't push it. You'll see the theme that I've said through all these exercises is not to push. You want to be gentle at this stage. 10 of those. That one ideally every 2 hours. If the back lets you, give it a little bit more and push up into that if you can. If it doesn't allow you to push up, that's totally okay. That will help a bulging disc. That's quite an evidence-based exercise. However, if you're over the age of, let's say, around about 35, your discs may not have as much fluid in them as they perhaps used to. And if you do those 10 and you find that your symptoms are worse, then definitely do not repeat doing those. And what likely will help is if we flip over and do the exact opposite movement. So what that looks like, and a little bit of support for the head, I'll show you this one. What that looks like is this. Knees to chest, very gently drawing the knees into the chest. So this is the opposite movement. This flexes the lumbar spine and also helps to decompress the low back area. Same deal, 10 of these as well. If those extensions that we just did make the back worse, these knees to chest will more than likely help, so you can try those out. If none of that is working, make sure you really go and see your medical practitioner and work out what is going on, and that'll make a big difference. Thanks for watching right through to the end of that, and hopefully those tips really make a big difference for you and are relieving. If you want more tips like that, make sure you subscribe to the channel. If you happen to live in Melbourne, you need our professional help, then get in touch with the clinic and we can sort that back out and sciatica for you.